Hello and welcome back to Humana Insurance Tutorial Series. I'm Nick and today we are going to dive into Humana Medicaid video tutorial part 4.1, and we are going to cover four important topics on Humana Medicaid, and those are: number one, Introduction to Medicaid and Humana Medicaid; number two, eligibility requirements; number three, how to apply; and number four, benefits and coverage. All right, so without taking much time, let's get started. So, introduction to Medicaid and Humana Medicaid. We will understand what Medicaid is, its eligibility criteria, and the benefit it provides. Introduction to Humana as a provider and its role in offering Medicaid plans. We'll also understand types of Medicaid plans offered by Humana. Let's understand these points one by one. Let's first understand what Medicaid is. Medicaid is a joint federal and state program in the United States that provides health coverage to individuals and families with low income and resources. Established in 1965 under the Social Security Amendments, Medicare is designed to offer medical assistance to those who cannot afford to pay for healthcare. The program covers a wide range of medical services and is administered by states within federal guidelines, leading to variations in coverage and eligibility across different states. Eligibility criteria. Eligibility for Medicare is primarily based on income, but it is also considered other factors such as family size, disability status, and specific health needs. While each state has its own set of rules, the general eligibility criteria includes: number one, income level. Eligibility is largely based on the federal poverty level, which is also called as FPL in short form. States may have different income threshold for different population groups such as children, pregnant women, adults, and people with disabilities. Now, number two, categorical eligibility. Children often cover up to a higher percentage of the FPL. Pregnant women typically eligible at the higher income levels to ensure prenatal and postpartum care. Parents and caregiver may be eligible based on income and household size. Adults under the Affordable Care Act, which is called as ACA, many states expanded Medicaid to include adults under 65 with income up to 138% of the FPL. Elderly and disabled individuals who are aged, blind, or disabled may qualify based on income and asset limits. Now, residency, number three. Applicants must be resident of the states in which they are applying. Number four, citizenship. Must be a US citizen or meet certain immigration status requirements. Some groups like lawful permanent residents may have to wait 5 years before becoming eligible through their though they are exceptions for specific groups such as refugees. Number five, other criteria. Individuals must meet other state specific requirements, which might include asset limits or participations in specific health related programs. Benefits provided by Medicaid. Now, Medicaid provides a comprehensive range of health benefits, which can vary by states but generally includes the following core services. Number one, mandatory benefit must be provided by all states. Inpatient and outpatient hospital services, coverage for hospital stays, surgeries, and outpatient procedure. Physician services, regular doctor visits, and specialist consultation. Laboratory and X-ray services, diagnostics test and imaging services. Now, home health services, medical care provided at home, often for individuals with chronic conditions or disabilities. Nursing facility services, long-term care in nursing homes for eligible individuals aged 21 and older. Mandatory benefits must be provided by all states, and this is benefits provided by Medicaid. Okay, family planning services, contraception and other family planning services, rural health clinic services, health services in rural clinic to improve access to care, federally qualified health care services, services provided by the health center in underserved areas, pediatric and family nurse practitioner services, services offered by nurse practitioners specializing in pediatrics and family health, nurse midwife service, care provided by certified nurse midwives, early and periodic screening, diagnostic, and treatment, which is also called as EPSDT. All right, it is called as EPSDT in short form. Comprehensive and preventive health services for children under 21. Benefits provided by Medicaid. Number two, optional benefits states may choose to provide. Prescription drugs, medication coverage, dental services, dental care for adult and children, though often more limited for adults, vision services, eye exams and glasses, physical therapy, rehabilitation services, chiropractic service, spinal manipulation and related treatment, personal care services, assistance with daily activities for those with disabilities or chronic illness, hospice care, end of life care services. Now, additional support and managed care. Many states uses Medicaid managed care plans where beneficiaries enroll in private health plans that provides Medicaid benefits. These plans often offer additional services such as care coordination and health education aiming to improve health outcomes and manage costs. Now, introduction to Humana as a provider and its role in offering Medicaid plans. Introduction of Humana as a provider. Humana Inc. is a prominent health insurance company based in United States that provides a range of healthcare services and insurance products, founded in 1961 and headquartered in Louisville, Kentucky. Humana has grown to become one of the largest health insurance providers in the country, serving millions of members. Now, Humana's role in offering Medicare plans. Humana plays a significant role in offering plans as part of its mission to improve the health and well-being of its members. As a Medicaid managed care organization, which is called as MCO in short, Humana partners with state governments to provide Medicaid benefits to eligible individuals. Here is an overview of Humana's involvement in Medicaid. Now, Humana's role in offering Medicaid plans, guys. Number one, managed care approach. Coordination of care. Humana provides a managed care approach where members are enrolled in a health plan that coordinates their healthcare services. This includes primary care, specialty care, hospital services, and more. Provider networks. Humana maintains a network of healthcare providers, including doctors, hospitals, and clinics, ensuring that members have access to necessary medical services. Number two, Medicaid plan offerings. Variety of plans. Humana offers different types of Medicaid plans tailored to meet the needs of various populations, including families, children, pregnant women, elderly individuals, and those with disabilities. State specific plans. Since Medicaid is administered at the state level, Humana's Medicaid plans are designed to comply with state specific regulations and requirements, providing localized support and services. Now, Humana's role in offering Medicaid plans. Number three, benefits and services. Comprehensive coverage. Humana Medicare plans typically cover a wide range of healthcare services such as a doctor's visit, a hospital stays, prescription medications, preventive care, and mental health services. Additional benefits. Many Humana Medicaid plans offers extra benefits that goes beyond standard Medicaid coverage. These might include dental and vision care, wellness programs, transportation assistance, and care management services. Now, number four, member support and resources. Customer service. Humana provides robust customer support to help members understand their benefits, find providers, and navigate the healthcare system. Online tools and resources. Members have access to online portals and mobile apps where they can manage their health benefits, find healthcare providers, and access health information. Now, number five, focus on preventive care and wellness. Preventive services, emphasizing the importance of preventive care, Humana encourage regular checkups, screenings, and vaccinations to help members maintain good health and prevent serious illness. Wellness programs. Humana often includes wellness programs in their Medicaid plans, which may offer incentives for healthy behaviors such as quitting smoking or managing chronic conditions effectively. Now, number six, community involvement. Health education. Humana engaged in community outreach and health education initiatives to promote better health outcomes among Medicaid recipients. Parties, partnerships. Humana collaborates with community organizations, healthcare providers, and state agencies to address public health challenges and improve access to care. Types of Medicaid plans offered by Humana. Humana offers several types of Medicaid plans to cater to the diverse need of eligible individuals. These plans are designed to provide comprehensive healthcare coverage while ensuring that members receive the necessary support and resources. Here are the main types of Medicaid plans offered by Humana. Number one, Medicaid managed care plans. Humana's Medicaid managed care plans provide a comprehensive range of healthcare services through a coordinated network of healthcare providers. These plans typically include the following types. Number one, Medicaid managed care plans, Humana Gold Plus integrated, Medicaid, Medicare plan, which is called as MMP, guys. All right. For dual eligibles, this plan is designed for individuals who qualify for both Medicare and Medicaid. It combines the benefits of both programs into one integrated plan. Comprehensive coverage includes hospitals, medicals, and prescription drug coverage, along with additional benefits such as dental, vision, and hearing services. B. Humana Healthy Horizons. State specific plans. These plans are tailored to meet the requirements and regulations of individual states. Wide range of services covers doctor visits, hospital stays, prescription medications, preventive care, and additional services like behavioral health and transportation. Number two, long-term services and support plans, which is also called as LTSS in short form. All right. These plans are designed to provide care for individuals with chronic illness and disabilities who need long term services and support. A. Home and community based services, which is also called as HCBS. Okay, in short, in home care supports individuals who prefer to receive care in their homes rather than in the institutional settings. Personal care services includes assistance with daily living activities such as bathing, dressing, and meal preparation. B. Nursing facility services. Institutional care provides coverage for long-term care in nursing facility for individuals who need around-the-clock medical attention and support. Number three, specialized plan for specific population. Humana offers plans that cater to specific groups with unique healthcare needs. A Children's Health Insurance Program, which is also called as CHIP programs in short form, coverage for children, provides health insurance for children in families that earn too much to qualify for Medicaid but cannot afford private insurance. Comprehensive benefits includes routine checkups, immunization, doctor visits, prescription, dental and vision care, and inpatients and outpatients hospital care. B. Pregnant women and new mothers. Maternity care covers prenatal delivery and postpartum care. Additional support often includes programs to support healthy pregnancy, breastfeeding, and early childhood care. Number four, behavioral health plans. These plans focus on providing mental health and substance use disorder services. A. Integrated behavioral health services. Mental health care covers counseling, therapy, psychiatric consultations, and medication management. Substance use treatment includes detoxification, residential treatment, and outpatient services for substance use disorder. Number five, medically need plans. These plans are for individuals whose income is too high to qualify for regular Medicaid but who have significant medical expenses. A. Spend down programs. Income adjustment allows individuals to spend down their income to the Medicaid eligibility level by subtracting in- incurred medical expenses. Temporary coverage provides Medicaid benefits for a specified period once the spend down requirement is met. Number six, enhanced benefit enhanced benefits and value added services. Humana often includes additional benefits in its Medicaid plans to enhance members' well-being and satisfaction. A wellness and preventive program. Health and wellness program encouraged healthy behaviors and chronic disease management. Incentives for healthy activities, rewards for activities such as regular exercise, smoking cessation, and attending wellness checkups. B. Care management and coordinations, personalized care plans. Case managers work with members to create individualized care plans. Support service includes help with navigating the healthcare system, scheduling appointments, and accessing community resources. Okay, now number two, eligibility requirement. Here we are going to cover general eligibility criteria for Medicaid, specific eligibility requirement for Humana Medicaid plans, importance of checking state specific requirement as Medicaid is state administered. General eligibility criteria for Medicaid. Medicaid is a joint federal and state program that provides health coverage to low income individuals and families. The eligibility criteria can vary somewhat from state to state due to the flexibility states have in administering the program, but there are general federal guidelines that all states must follow. Here are the general eligibility criteria for Medicaid. General eligibility criteria for Medicaid. Number one, income requirements. Low income families. Medicaid provides coverage to families with children where income is below a certain percentage of the federal poverty level FPL. The exact percentage varies by state. Pregnant woman. Generally, pregnant women with incomes up to 138% of the FPL are eligible. Some states extend coverage to pregnant women with higher incomes. Children. Many states cover children in family with incomes up to 138% of the FPL or higher under Medicaid uh, and the Children's Health Insurance Program, which is also called as CHIP. Okay, adults without dependent children. Under the Affordable Care Act, which is called as ACA, Medicaid was expanded to cover adults aged 19 till 64 with incomes up to 138% of the FPL in states that choose to expand Medicaid. Number two, categorical, categorical requirements. Children. Medicaid covers children from low income families, pregnant women, eligible at various income levels, often up to 138% of the FPL, parents and caretaker relatives. Medicaid covers low income parents and caretakers of minor children, individuals with disabilities. Coverage for those who receive supplemental security income, which is called as SSI, or meet other disability related criteria. Elderly individuals generally covers those 65 and older who meet income and asset requirements. Now, number three, asset requirements. For certain groups, such as the elderly and individuals with disabilities, Medicaid considers both income and assets. States set asset limits, which can include cash, bank accounts, and property. Number four, citizenship and residency. US citizenship. Generally, individual must be US citizens or lawful permanent residents. State residency applicant must reside in the states where they are applying for Medicaid. Number five, special programs and waivers. States may have special programs and waivers that provide Medicaid to specific groups not typically covered under standard Medicaid eligibility rules. These can include home and community based services for individuals who require long term care, among other programs. Number six, other criteria. Pregnancy status. Pregnant women often have higher income limits. Age. Certain age groups, like children and elderly, may have different eligibility criteria. Disability status. Individuals with disabilities often qualify based on different income and asset limits. Now, specific eligibility requirements for Humana Medicaid plans. Humana Medicaid plans are specific to each state where Humana operates and administers Medicaid programs. The eligibility requirements for Humana Medicaid plans are generally aligned with the state's Medicaid eligibility criteria, but can include additional specific conditions based on state policies and agreements with Humana. Below are the typical eligibility requirements with the understanding that exact details may vary by states. Specific eligibility requirement for Humana Medicaid plans. General Medicaid eligibility criteria, guys. Number one, income requirements. Low income families, families with children who meet the state's income criteria. Pregnant women, usually eligible if income is up to 138% of the federal poverty level FPL. Children, coverage typically for children in families and incomes up to 138% of the FPL or higher. Adults without dependent children. In the states that have expanded Medicare under the ACA, adults with incomes up to 138% of the FPL are eligible. Elderly and disabled. Individuals receiving supplemental security income SSI or meeting state specific disability income limits. Now, general Medicaid eligibility criteria 2, categorical requirement children. Medicaid covers low income children. Pregnant women. Medicaid provides coverage during pregnancy and postpartum. Parents and caretaker relatives. Coverage for low income parents and caretakers. Individuals with disabilities. Medicaid includes those who are disabled and meet income and asset limits. Elderly individuals, those 65 and older with qualifying income and asset levels. Number three, asset requirements. Certain groups like the elderly and disabled have to meet asset limits, which may include cash savings and property limits set by the states. Okay, citizenship and residency. US citizenship generally require a lawful permanent resident status. State residency must reside in the states where applying for Medicaid. Okay, number five, special program and waiver. State may have additional programs and waivers that provides coverage for specific groups beyond standard Medicaid eligibility, such as those needing long-term care services. Now, specific eligibility requirement for Humana Medicaid plans. Humana specific considerations, plan availability. Eligibility for specific Humana Medicaid plans depends on the states and the countries within the states where Humana offers these plans. Enrollment in state Medicaid. Individual must first be enrolled in the state Medicaid program before they can assign or choose a Humana Medicaid plan. Additional benefits. Humana may offer extra benefits beyond standard Medicaid coverage, such as wellness programs, dental care, vision care, or transportation services. But eligibility for these additional benefits is typically tied to the general Medicaid eligibility in the states. Now, a specific eligibility requirement for Humana Medicaid plan, state-specific examples. Florida, Humana Medicaid plans in Florida may have additional requirements specific to the state's Medicaid managed care program, which is also called as SMMC. All right. Kentucky, Humana administered Medicaid in Kentucky through the Kentucky Medicaid managed care program with eligibility criteria aligned with state guidelines. Illinois. Humana Medicaid plans in Illinois are part of the state's Medicare managed care program, adhering to state specific eligibility and enrollment requirements. Specific eligibility requirement for Humana Medicare plans. To determine specific eligibility requirement for Humana Medicaid plan, individuals should refer to their state's Medicaid program guidelines and contact Humana directly for detailed information related to their specific location. The state Medicaid agency and Humana customer service can provide the most accurate and comprehensive details regarding eligibility and plan specific, guys. Importance of checking state specific requirements as Medicaid is state administered. Navigating Medicaid can be a challenging task, especially since it is a program administered at the state level. Today, we will explore why it is crucial to check state specific requirements when applying for Medicaid benefits. Medicaid is a federal and state partnership designed to provide healthcare to eligible low income individuals and families. However, each state has the flexibility to design and operates its own Medicaid program within federal guidelines. This means that eligibility criteria, covered services, and application process can vary significantly from one state to another. Let's break down why it is essential to check the specifics of for your states. Firstly, eligibility requirements. While federal law sets broad standards, states have the authority to expand coverage, set income limits, and define what constitutes medically needy categories. For example, some states have expanded Medicaid under the Affordable Care Act, while others have not. If you move from one state to another, the benefits you qualify for in one state might not be the same in another. Therefore, always verify the income threshold and other eligibility criteria specific to your state. Second, covered service. Each state determines the types and extent for service covered by Medicaid. This includes prescription drugs, dental services, vision care, and some states offer more comprehensive coverage than others. For instance, dental services might be covered in one state but not in another. Understanding what your state covers ensures you receive all the benefits you are entitled. But application and renewal process, state uses different systems and procedure for applying to and renewing Medicaid. Some states have online applications while others require in-person visits. Knowing your state's process can save your time and prevent delays in receiving benefits. Always visit your state's Medicaid website or contact a local office for the most accurate and updated information. Checking state specific requirements for Medicaid is more than just a step in the process. It's the key to unlocking the healthcare benefits you need. Stay informed, stay proactive, and ensure you are getting the best possible care through your state's Medicaid program. Visit your state's Medicaid website or contact your local Medicaid office for personalized assistance. Your health is worth it. Okay. Number three, how to apply. In how to apply, we will understand application process for Medicaid, step-by-step guide to applying for Humana Medicaid through their website and other designated platform. Application process for Medicaid. Gather necessary documents. Before you start your application, gather the following documents. Proof of identity, for example, driver's license, passport, social security number, proof of income like pay stubs, tax returns, proof of residency like utility bill, lease agreement, health insurance information if applicable. Having these documents ready will make the application process smoother. Application methods. You can apply for Medicaid through several methods. Online, visit your state's Medicaid website and complete the application online. In person, you can go to your local Medicare office to apply in person. Staff can assist you with the application. By mail, Download and print the application form from your state's Medicaid website, fill it out, and mail it to the address provided. By phone. Some states allow you to apply by calling a toll free number and completing the application over the phone. Choose the method that is most convenient for you. Filling out the application. When filling out your Medicaid application, answer all questions truthfully and accurately. Provide all requested information and documentation. If you are unsure about a question, contact your local Medicaid office for help. Choose the method that is most convenient for you. Submit your application. Now, submit your application and wait for a decision. After submitting your application, you will receive a confirmation. The processing time can vary, but you should hear back within a few weeks. If additional information is needed, respond promptly to avoid delays. During this time, you can check the status of your application online or by contacting your local Medicare office. Receive your benefits. Now, receive your benefits once your application is approved. You will receive information about your coverage, including when it starts and how to use it. If you are denied, you will receive an explanation and information on how to appeal the decision. Keep your Medicaid card safe and always bring it with you when accessing healthcare services. And that's it. By following this, you can successfully apply for Medicaid and get the health coverage you need. If you have any questions, don't hesitate to reach out to your local Medicaid office for help. Now, step-by-step guide to applying for Humana Medicaid through their website or other designated platform. Step-by-step guide to applying for Humana Medicaid through their website. Number one, visit the Humana Medicaid website. Go to the official Humana Medicaid website. You can do this by typing Humana Medicaid into your preferred search engine and clicking on the official link. Number two, navigate to the enrollment section. Look for a section on the website specifically dedicated to enrollment or applying for Medicaid. This may be labeled as Apply Now or Enroll. Number three, check eligibility requirements. Before beginning the application process, ensure that you meet the eligibility requirements for Medicaid in your state. This requirement can vary, so it's essential to review them carefully. Number four, create an account if required. Some Medicaid application may require you to create an account on the Humana website. If so, follow the prompt to create your account, providing the necessary information such as your name, email address, and a password. Number five, start the application once logged in. If necessary, you can begin the application process. This typically involves providing personal information such as your name, address, date of birth, social security number, and household income. Be sure to have any relevant documents on hand, such as pay stubs or tax returns, as you may need to provide proof of income. Number six, complete the application form. Follow the prompts to complete each sections of the application form accurately. Double check your entries for accuracy before submitting. Number seven, submit required documents. Depending on your state's requirement, you may need to submit additional documents to support your application. This could include proof of income, residency, citizenship, or other eligibility criteria. If required, scan or take photos of these documents and upload them through the website. Number 8, review and submit. Once you have completed all sections of your application and attached any necessary documents, review the information you have provided to ensure it's accurate. Once satisfied, submit your application. Number 9, confirmation. After submitting your application, you should receive a confirmation message indicating that your application has been successfully submitted. This may include a reference number or confirmation email for your records. Number 10, follow up. Keep an eye on your email box or the application portal for any updates on the status of your application. If additional information is needed or if your application is approved, you will be notified accordingly. Number 11, stay informed. Throughout the application process, familiarize yourself with Humana's Medicaid offerings, including coverage options, benefits, and any associated costs. This will help you make informed decision about your healthcare coverage once your application is approved. If you encountered any difficulty during the application process, don't hesitate to reach out to Humana's customer service for assistance. They should be able to provide guidance and support to help you successfully complete your application. Now, number 4, benefits and coverage. That's what we are going to cover. In that, benefit covered under Humana Medicaid plans such as doctor visits, hospital stays, prescription, and preventive care. Additional benefit that might be unique to Humana, like wellness program or dental and vision care. Limitation or exclusions in the coverage. So we are going to understand this benefits and coverage. Now, benefits covered under Humana Medicaid plans such as doctor visits, hospital stays, prescriptions, and preventive care. Now, Humana Medicaid plans offered a variety of benefits that typically include essential healthcare services. Here is an overview of the benefits generally covered under Humana Medicaid plan. Number 1, doctor's visit, primary care visit, specialist visits, annual physical exams, preventive care services such as vaccination and screening. Number 2, hospital stays, inpatient hospital care, outpatient hospital services, emergency room visits, surgical procedure. Now, number 3, prescription drugs. In that, coverage for a wide range of prescription medications, access to a formulary, a list of covered drugs, option for mail order pharmacy services for certain medications. Now, number 4, preventive care. In that, routine immunization, health screenings, for example, mammograms, colonoscopies, wellness programs and educations, health assessments. Now, number 5, behavioral health services, mental health counseling, substance use disorder treatment, psychiatric care. Now, number 6, maternity and newborn care, prenatal and postnatal care, labor and delivery services, newborn screening and care, pediatric services. Number 7, pediatric services, well child visits, immunization, vision and dental care for children. Number 8, vision and dental care, routine eye exams, prescription eyeglasses, basic dental services like cleanings, fillings, preventive dental care. Number 9, long-term services and support, home health care, personal care services, and nursing home care. Number 10, Transportation services, non-emergency medical transportations to and from medical appointments. Number 11, rehabilitation and therapy services, physical therapy, occupational therapy, and speech therapy. Number 12, durable medical equipment, which is also called as DME. Medical supplies, for example, diabetic supplies, and equipment like wheelchairs, walkers, and oxygen supplies. Number 13, hearing services, routine hearing exams, and hearing aids. Number 14, other services, telehealth or telemedicine services, case management and care coordination, and health and wellness program. The exact benefits and coverage details can vary by states and the specific Medicaid plan you enroll in. Okay, so the exact benefits and coverage detail can vary by states and the specific Medicaid plan you enroll in. As Medicaid is a joint federal and state program, and each state administers its own Medicaid program within federal guidelines. For precise information on the benefit available in your area, it is best to review the specific Humana Medicaid plan details or contact Humana customer service directly. Now, additional benefits that might be unique to Humana, like wellness programs or dental and vision care. Humana offers several unique benefits that distinguish it from other health insurance providers. Here are some of the notable features and program. Wellness program. Number one, Go 365. Humana's Go 365 program is a personalized wellness and reward programs. It encourages healthy behaviors through various activities and challenges, rewarding members with points that can be redeemed for fitness gear, gift cards, and more. The program includes activities like health assessments, biometric screenings, fitness tracking, and preventive screening. Number two, behavioral health services. Humana provides extensive behavioral health services, excluding mental health and substance use disorder treatments. These services are integrated into many of their health plans. Now, additional benefit that might be unique to Humana, like wellness program or dental and vision care. Dental and vision care. Number one, comprehensive dental coverage. Humana offers a variety of dental plans that cover preventive care, basic services such as fillings, and major services such as crowns and root canals. Some plans also include orthodontic coverage. Plans often provide access to a large network of dentists and include features like no waiting period for preventive services. Number two, vision coverage. Humana's vision plans typically cover routine eye exams, eyeglasses, and contact lenses. Some plans also provide discounts on LASIK surgery. Members have access to a large network of optometrists and ophthalmologists. Chronic condition management. Humana chronic condition special need plans, which is also called as C-SNPS. Okay, these plans are designed for individuals with specific chronic conditions such as diabetes, heart disease, and chronic lung disorders. They provide tailored benefits include enhanced care, coordination, and management support. Additional benefits that might be unique to Humana, like wellness programs or dental and vision care. Now, telehealth services. Telemedicine. Humana offers telehealth services, allowing members to consult with healthcare providers remotely. This service is particularly beneficial for those with mobility issues or those living in remote areas. These services cover a wide range of healthcare needs, from urgent care consultation to behavioral health services. Pharmacy benefits, mail order pharmacy. Now, Humana Pharmacy provides a convenient mail order services, allowing members to receive their prescriptions delivered to their doorstep. These services often include cost savings and medications management support. Wellness discounts and additional perks. Healthy living. Healthy living discounts. Humana members can access discounts on various health and wellness programs, wellness products, and services, including gym memberships, weight loss programs, and alternative therapies like acupuncture and massage therapy. Silver sneakers. Many Humana Medicare Advantage plans include Silver Sneakers, a fitness program specifically designed for older adults. These programs offer free gym memberships, fitness classes, and access to community events. Support and resources. Humana First Nurse Advice Line. Okay, members have access to a 24/7 nurse advice line providing support and guidance for health related questions and concerns. Personal health coaching. Humana provides personal health coaching services to help members set and achieve health goals, manage chronic conditions, and adopt healthier lifestyles. These programs and benefits reflect Humana's commitment to a holistic approach to health and wellness, aiming to support not just the physical health of their members but also their mental and emotional well-being. Limitations and exclusions in the coverage. Okay, Humanas, like all health insurance providers, has certain limitations and exclusions in this coverage. Here are some common limitations and exclusions typically found in Humana's health insurance plans. General exclusions. Number one, cosmetic procedure. Procedure that are primarily for cosmetic purpose, such as plastic surgery, are typically not covered unless they are medically necessary. For example, reconstructive surgery after an accident. Number two, experimental or investigational treatments. Treatments and procedure that are considered experimental or investigational are generally not covered. This includes new treatments that have not been widely accepted as standard medical practice. General exclusions. Number three, non-essential health services, services that are not deemed medically necessary, such as elective procedure, are not covered. Number four, over-the-counter medications. Most over-the-counter drugs and supplies are not covered unless prescribed by a doctor for a specific medical conditions. Specific services exclusions. Alternative and complementary treatments. Treatments such as acupuncture, neuropathy, and homeopathy are often excluded unless specifically covered under a particular plan. Number two, dental and vision. Basic health. Specific services exclusions. Number one, alternative and complementary treatments. Treatments such as acupuncture, neuropathy, and homeopathy are often excluded unless specifically covered under a particular plan. Dental and vision. Basic health insurance plans typically do not cover routine dental and vision care. Separate dental and vision plans are usually required for these services. Number three, hearing aids. Coverage for hearing aids may be limited or excluded entirely, although some plans, particularly Medicare Advantage plan, might offer limited coverage. Plan specific limitation. Number one, network restrictions. Humana plans often have network restrictions, meaning you must use healthcare providers within the plan's network to receive full benefit. Out of network care is usually more expensive and may have limited coverage. Number two, prior authorization requirement. Certain procedures and medications require prior authorization from Humana. Without prior authorization, these services may not be covered. Number three, annual and lifetime limits. Some plan may have annual or lifetime limits on certain types of care or services, such as a cap on the numbers of physical therapy sessions per year. Number four, prescription drug formulary. Not only all prescription medications are covered, Humana has a formulary, a list of covered medications, and drugs not on this list may not be covered or may require higher out-of-pocket cost. Limitations or exclusions in coverage, cost related limitations. Now we'll talk about cost related limitations. Number one, deductibles and co-payments. Members are responsible for meeting deductibles and paying co-payments or co-insurance for many services. These costs can vary widely depending on the plan. Out of pocket maximums. Out of pocket maximums. Number two, while Humana plans typically have out of pocket maximums to protect against catastrophic expenses, not all costs count toward these maximums. For example, premiums, balance bill charges. Special coverage limitation. Number one, mental health and substance abuse. Coverage for mental health and substance abuse services might have specific limitations, such as caps on the number of visits or day covers for inpatient treatment. Number two, rehabilitation services. Physical, occupational, and speech therapy services may have limits on the number of sessions covered per year. Number three, home health care. Coverage for home health care services is often limited to a certain number of visits per year and requires prior authorization. Miscellaneous exclusions. Number one, long-term care. Long-term care such as custodial care in a nursing home or assisted living facility is typically not covered. Number two, private duty nursing. Private duty nursing care is generally excluded from coverage. Number three, infertility treatment. Treatments for infertility, including in vitro fertilization, which is called as IVF, and other assisted reproductive technologies, are often excluded. Number four, weight loss program and surgery. Coverage for weight loss programs and bariatric surgery can be limited and often require prior authorization and meeting specific medical criteria. It's important for members to thoroughly review their specific plan documents and summary of benefits to understand the detailed limitations and exclusion applicable to their coverage. Alright guys, so that's all about this video. I hope that you found this video useful. If you enjoyed watching this video, then do give it a thumbs up
and subscribe my channel for more informative videos, and don't forget to hit that notification bell so that you never miss any updates, guys. All right, so thanks for watching and stay tuned for Medicare 4.2, guys. Bye bye.